Hello, my name is Rachel Myers. I am a Master's of Science in Applied Nutrition candidate, and this is my capstone project presentation, The Effect of Omega-3 Fatty Acids and Physical Activity on Cognitive Function, a Systematic Review. The objective of this presentation is to explain the current concerns related to dementia, to outline the literature of dual interventions of omega-3 fatty acids and physical activity, to discuss the results and interpret the findings of the systematic review, and to summarize potential future research opportunities. Dementia is a vast challenge to our society with no known cure or effective treatment. It is defined as the loss of cognitive functioning tied to the ability to reason, remember, and think in a way that it restricts one's daily life and capabilities. While millions of people are afflicted by dementia, it is not a normal process of human aging. Most common form of dementia is Alzheimer's disease. In America today, there are more than 6 million people burdened with Alzheimer's disease. The cost of care in the U.S. in 2023 for Alzheimer's disease alone is approximately $345 billion. By the year 2050, the number of people afflicted with Alzheimer's disease is expected to more than double, with costs rising exponentially to $1 trillion annually. Due to the tremendous strain dementia places on our economy, research must be conducted to look for interventions to decrease this disorder. The etiology of cognitive decline is primarily age, with the condition being more common in persons aged 65 and older. There is no cure for dementia, and the interventions available are currently only supportive in nature. These focus on maintaining the person's well-being through physical activity and nutrition, along with brain stimulation through social and mental activities. There are current approaches in the literature with the aim to prevent the syndrome by the reduction of risk factors. While there's no way at present to prevent dementia, there is evidence to support the use of both physical activity and healthy diet for risk reduction. This slide shows some of the risk factors and symptoms of dementia and Alzheimer's disease, along with some of the methods currently used to aid in prevention of the disease. In the 1980s, the top 10 causes of death for persons aged 65 years and older did not include any form of cognitive dysfunction such as dementia or Alzheimer's disease. However, when the main causes of death were analyzed for 2021, Alzheimer's disease came in 7th for causes of death. Physical activity supports the brain and cognitive function in various ways, including improving circulation, stress reduction, and supporting brain plasticity. Physical activity increases brain-derived neurotropic factor, which stimulates mitochondrial biosynthesis, improving cognition. A decrease in the production of free radicals have also been noted as a benefit of physical activity. This connection between physical activity and the hippocampus shows a correlation between physical activity and memory. Favorable outcomes in cognitive function with older adults have been noted through moderate to vigorous physical activity. There is some evidence that aging decreases the amount of omega-3 fatty acids in the brain. Increasing the intake of these omega-3s in the diet has been shown to have the ability to reduce the risk of cognitive decline. More specifically, that a higher amount of omega-3 fatty acids in the cell membranes might decrease cerebral inflammation as well as reduce the risk of stroke, which is linked to the increased rate of vascular dementia and Alzheimer's disease. Promise for reduction in risk of dementia is noted in the literature for both omega-3 fatty acids and physical activity. There is a lack of cohesion in the existing studies. To our knowledge, the dual intervention of omega-3 fatty acids and physical activity together to mitigate dementia has not been reviewed. It is necessary to systematically summarize and analyze this dual intervention to better understand their implication on Alzheimer's disease and dementia. The major research question is, in adults aged 60 years or older, does 900 milligrams per day of omega-3 fatty acid supplementation or more and physical activity for 8 weeks or longer maintain cognitive function compared with control of physical activity and placebo? Research on the 6 databases was completed with the above search criteria strategy on January 15, 2024. PubMed was utilized to acquire specific mesh search terms. All potential search terms were integrated into the advanced search functions. With PubMed Medline, these additional filters were applied. Only clinical trials from 1999 to 2024, and to maximize results, specific population of adult and human were reviewed within each full text result selected from these databases. This systematic review applied the following inclusion criteria. Control trials containing an intervention group receiving 900 milligrams or more omega-3 fatty acid supplementation per day, and physical activity in the comparison to a placebo and physical activity. Studies involving human adults aged 60 years or older, male or female, in all settings and countries with cognitive function changes. We included studies with at least 8 people in each study group, and studies between the years of 1999 and 2024. There was no exclusion for studies published in a language other than English. And finally, we included studies which provided omega-3 fatty acid supplementation for 8 weeks or longer. Exclusion criteria comprised of studies which did not contain cognitive function testing, at least 900 milligrams of omega-3 fatty acids daily, had no physical activity component in both intervention and control group. Non-human studies were excluded, as well as studies with participants under the age of 60. And they did not have at least 8 participants in each comparison group. Any studies which occurred before 1999, no non-primary research was included. And finally, we excluded any study which did not provide omega-3 fatty acid supplementation for at least 8 weeks. After primary research and removal of duplicate articles, the titles and abstracts of 554 articles were checked. 44 applicable articles were examined by full-text review. The reference lists from the selected articles were examined to search for further applicable studies, which yielded 6 articles not previously found. Ultimately, 12 articles were selected for the systematic review, and the selection procedure is displayed here in this figure. Visuals of some of the characteristics of the different studies are shown here. Both genders were included in 75% of the studies, with another 8% of the studies being male only and 17% being female only. The studies were published from 2015 to 2022. 50% of the included studies were comprised of participants with no mild cognitive impairment, 42% were focused on those with mild cognitive impairment, and 8% of the studies did not differentiate between the level of cognitive function. The last name of the first author, year of publication, country the study was completed in, types of cognitive function tests performed, the dose of omega-3 fatty acids, and form of physical activity, as well as the length of the study, gender of study participants, the participant's age, the number of participants in each group, study design, the cognitive function test used, and summarized results were extracted from each article and summarized here in this table. Of the 12 studies included, 8 were double-blind with placebo randomized control trial, 3 were single-blinded placebo randomized control trials, and 1 was a self-select study without blinding or placebo. The results of this systematic review were analyzed based on the main differences between the included studies. These focused on physical activity type, the amount of supplemental omega-3 fatty acid, the typical fish intake of the study country, the length of the study, and APOE typing. Results were highly varied when differentiated by physical activity type. All studies incorporated some form of physical activity as an intervention, along with either placebo or omega-3 fatty acid supplementation. 3 studies utilized combined physical activity intervention with cardiovascular and strength training together. 2 of these studies were significant or conditionally significant. There was a solitary study that incorporated only strength training. It did not report significant results. Intense cardiovascular only activity was used in 3 studies, 2 of which did not report statistically significant between supplement and control. Moderate cardiovascular activity yielded 2 studies with positive results, and 1 with conditional statistically significant results when modified for the intent to treat analysis. The last 2 studies did not fit into a generalizable category. Stavenroot et al. Had participants maintain their activities of daily living and saw statistical significance supporting the intervention over control, and Mingleberg et al. Only measured the activity that the participants were doing. They reported conditionally significant result when reviewing only participants without the APOE E4 gene. The amounts of supplemented omega-3 fatty acids ranged from 1,000 to 4,950 milligrams per day. Many of the studies ranged from 1,000 to 2,000 milligrams, with 4 of these reporting significant result, 3 reporting conditionally significant results, and 2 reporting non-significant differences. 2 studies reported on omega-3 fatty acid amounts in the 2,000 to 3,000 milligram per day range, both showing no significance. 1 study had supplemental omega-3 fatty acid in the 4,000 to 5,000 milligram range and did show a significant result. Results based on typical fish intake are difficult to infer from these data. There is a clustering of statistically significant difference in the results from countries with mid-high typical fish intake. In the studies which controlled and tracked fish intake, the results of the study tended to show statistically significant difference favoring the supplementation group. 5 studies had no controls reported for fish intake. 3 studies did not track fish in the diet but did ask the participants to keep their diet the same. 3 studies completed a food frequency questionnaire or other tracking of fish intake. Only 1 study reported exclusions for fish intake at the beginning of the study. There was notable variance in the length of studies with a range of 20 weeks to 3 years. Statistical significance was primarily clustered around the studies with shorter study lengths from 20 to 26 weeks, although there were 3 studies which were also 26 weeks that did not report significant results. Mingleberg et al. Study was the only literature incorporating 1 year of intervention, and they reported conditionally statistical significance. Bunn et al. Performed the only study that ran for 2 years, which also reported a statistically significant results. 2 of the studies incorporated durations greatly exceeding the others at 3 years, with 1 reporting no statistical significance and the other reporting conditional statistical significance. 4 out of 12 trials performed APOE typing of participants. Statistical significance was reported in half of these studies. Mingleberg et al. Performed APOE typing and holds conditional significance due to finding that participants without the APOE E4 gene had cognitive function test score improvements significantly better than control, with immediate R-bands of p equals 0.04 and delayed R-bands of p equals 0.02. The quality criteria checklist for primary research from the Academy of Nutrition and Dietetics was utilized to determine reporting biases. This checklist places priority on the validity criteria questions around selection bias, the comparability of study groups, if the intervention was adequately described, if the measurements and outcomes were valid and reliable, and if there was funding bias. Many studies held no notable risk of bias. 2 of the studies had some risk overall. Most of the bias found was related to risk of funding or sponsorship. 5 of the studies did not report if their source of funding was a conflict or if the funders participated in the aspects of the study. Overall, there is not enough data to fully support statistical significance of the dual intervention, although there are notable positive statistically significant results. Many of these significant findings occurred in the studies between 1,000 to 2,000 milligrams of the supplement per day, in studies with lengths between 20 to 26 weeks, and in studies which were completed in countries with mid-high typical fish intake. There were limitations noted within this systematic review. food intake of omega-3 fatty acids was not monitored in 6 of the 12 studies. This creates a source of error as many countries have a varying level of fatty fish intake from 2 servings of fish a day to 1 serving of fish per week. Supplement adherence was also highly variable, with some studies having pill adherence as low as 54%, although most fell between 80 to 100%. Only 2 of the studies excluded participants for low supplement adherence rates. The major limitation of this study is the attrition rate of participants in the studies. 5 of the 12 studies did not maintain an adequate number of study participants to maintain a power level of 80% with median effect size. Additionally, 2 studies did not provide suitable information to determine their initial power level or effect size. For our implications, we are certain that there is a notable positive effect with the dual intervention of omega-3 fatty acids and physical activity on CFTs. Stavenroot et al. Supplemented nearly 5 grams of omega-3 fatty acids daily in their study, and this level was well tolerated. This is the largest amount of omega-3 fatty acids to be supplemented in this population for this purpose. Safety protocols were put in place to manage the use of anticoagulants in the study participants. Furthermore, aged population has a higher attrition rate in studies. For that reason, researchers should plan their studies for dropout rates of at least 30%. Future research should focus on increasing recruitment to maintain study power and effect size, the study of high-level omega-3 fatty acid supplementation upwards of 5 grams daily, and incorporating different physical activity types into the studies. As DHA was noted in the literature to have a greater effect, there should be more studies with DHA as the specific omega-3 source. And finally, differentiation for APOE gene types can improve the understanding of how the intervention works in populations of different genomes. I have no disclosures for funding or conflicts of interest. Thank you for watching this presentation. I appreciate your time and interest in this systematic review. And here are my references.